So welcome everyone. My name is Belinda Needham, and I'm an associate professor and chair of the Department of Epidemiology. I'm joined today by the incredible faculty, staff, and students that you see pictured here. We are delighted that you are here today to learn more about the department and the University of Michigan. If you have questions, feel free to type them in the chat box during the presentation, or you can wait until the Q&A period at the end. So let's start with a pretty basic question. What is epidemiology? Epidemiology is the study of the distribution and determinants of health and disease in populations. Epidemiology is scientific, systematic, and data-driven. It focuses on identifying patterns and causes of health and disease, and the focus is on groups, not individuals. Epidemiology produces actionable results that can be used to improve population health. And of course, we've been able to see this over the past year and a half with the COVID-19 pandemic, where the work of epidemiologists has been so important. Epidemiologists study the determinants of health and disease, ranging from individual level factors like genetics and behavior to social and environmental factors like racism and climate change. We study all kinds of health outcomes, including infectious diseases, chronic diseases, and aging. And we do this in multiple settings, both within the US and globally. Some of us are more focused on research, while others are more practice-oriented. And there are many tools that epidemiologists use to study health. This includes observational studies, experimental or quasi-experimental studies, laboratory methods, systems modeling, and surveillance. Epidemiology is highly interdisciplinary. Faculty in our department have training in a number of fields, including medicine, ecology, mathematics, virology, sociology, and genetics. The breadth and depth of expertise that our faculty have is one of the main strengths of the epidemiology program at Michigan. But I want to highlight some of our other strengths as well. First and foremost, the program provides excellent training in theory, methods, and applications. Through your coursework and other training activities, you will develop strong analytical, presentation, and writing skills, which will help you throughout your career. In terms of internships, we offer lots of opportunities in different settings, locally, regionally, and globally. And there are many ways to become involved in research, whether that's in the lab, in the field, or on your laptop. Even though they're really busy, you'll find that our faculty are excited to work with students both inside and outside the classroom. This slide shows the distribution of students in our different MS and MPH programs. We have just under 200 master's students in 6 different programs that you'll hear more about later in the presentation. In terms of class sizes, our core courses typically have about 100 students, while our elective and track-specific courses have anywhere from 10 to 40 students. Your training might include some combination of lecture-based classes, labs, seminars, and practice activities. A question that's probably on everyone's mind is, will this program help me get a job? Graduate training in epidemiology prepares you for many jobs in research and public health practice. 100% of our students who graduated last year are either currently employed, pursuing an advanced degree, or completing a fellowship, internship, or residency program. Among those who are currently employed, about 36% work at a university or college, 23% work in a state or local health department, 15% work in a hospital, 10% in nonprofits, 9% for the federal government, and the rest work in consulting, state government, and industry. I want to finish up by saying a little bit about the department's goals and values. Our mission, the reason that we exist, is to reduce the disease burden in human populations through research, education, and service. In order to achieve that mission, we believe it is essential to offer high-quality instruction to a diverse student body in an equitable and inclusive environment. We hope that you will consider joining our community and helping us achieve our goal of improving population health. Now I'll turn it over to Dr. Carlos Mendez de Leon, who will share information about the general epidemiology track.
Thank you, Dr. Needham, and welcome to everyone there. It is great to have an opportunity to share some ideas about the general epidemiology program in our MPH program at the School of Public Health at Michigan. And first, I would like to say a few words what general epidemiology is anyway. General epidemiology focuses its training, its research, its service and practice on the determinants, the causes, and also the consequences of several of the variety of disease outcomes that occur in populations. So more specifically, the kind of diseases and outcomes, but also the determinants that we cover in our program include the following list. We have courses and training in chronic disease epidemiology, and you can think of disease outcomes such as cancer, cardiovascular disease, and stroke. Other courses would focus on the social determinants of health, the various sets of social factors that play such an incredibly influential role in the health of individuals and populations. Another section focuses on infectious diseases, the causes, the agents of infectious diseases, the way they are transmitted. Other work focuses on reproductive health. More recently, and hopefully not belatedly, we have to start focusing on climate change and the health consequences of climate change. In other work, again, that focuses on the microbiome. And in all of this, we keep in mind that the health outcomes and the health determinants that we study in epidemiology occur in diverse populations, both locally, here in our own regions, nationally, and also in terms of global health. And we do so, we offer this training, and in our practice and our research, we do so because the breadth of the skills and knowledge that we contribute is the foundation of robust public health practice. So the investigation and discovery that we do in general epidemiology are the core of what working epidemiologists do. So GE students in our program develop a foundation in the biology of a wide range of disease systems. We offer strong methods training that allows you to encounter new problems with the right tools. And finally, we focus on public health practice and communication so that we can turn our insights into actions in order to improve population health. Next, please. So what kind of skills do general epidemiology students develop? As Dr. Needham already mentioned, we offer training in both large and small scale study design. We offer methods, we offer training for methods for the effective and ethical data collection. And I would like to add here, data collection that recognizes the diversity of the populations that we serve in general epidemiology. So data collection that is inclusive and that includes people, individuals from various backgrounds in our own groups, in our own society, as well as globally. We offer also training in statistical analysis of complex data sets. We help you to become familiar with the broad knowledge of the epidemiologic literature. Another important aspect of our training is the effective communication of findings and recommendation. And then finally, an important aspect of our training program is translation of empirical findings into practice and policy. Next, please. So next, I would like to take you through 3 examples of research in which the masters and PhD students in our program, in the general epidemiology program, have played a very critical role. The first one here focuses on race-ethnic disparities in COVID-19 mortality in Michigan that are explained by differential exposure. And as you hopefully can see in the 4 graphs below the title there, they display the case fatalities in the various population groups here in our state, from left, the Asian Pacific Islander group, to African Americans in the second graph, to Latino population and the white population. And what you will notice is that the pattern in these graphs are more or less similar across the four population groups, suggesting that the case fatality actually does not differ, has not differed all that much by racial or ethnic background in our state. So there is a good news and a not so good news associated with this. The good news is perhaps that at least it suggests that the quality of care for COVID patients in our state didn't vary too much by racial ethnic background. On the other hand, we know that the incidence of COVID-19 was much higher in certain communities, and in particular in the Black and the Latino communities. And so therefore, if we could have the same type of incidence in those communities in our state that was observed in the white communities, we would have expected to see an 80% reduction in COVID-19 mortality rate among Africans, for example, in African Americans in Michigan. And so this suggests further that racial disparities in COVID-19 mortality in Michigan are not likely to be attributable to variations in rates of pre-existing conditions. So here's another example of a student-led research project. This focuses on HPV self-collection in Arab American women that was conducted by Laila Koja with advising from Dr. Lee Pierce in our department. I wanted to add here that Southeastern Michigan has a large Arab American community that centers around the city of Detroit, right next to the city of Dearborn, right next to Detroit. And cervical cancer is one of the most common causes of cancer mortality worldwide, caused by high-risk strains of the human papillomavirus, or HPV. In the US, PAP screening has drastically reduced incidence and mortality. However, important racial disparities in screening rates still exist, unfortunately. So this student, Laila, has been working with a community partner, Access, who serves the Arab American community in Dearborn and provides health services there to this population. And the student created a survey and recruited 500 women to fill out this survey and to evaluate their use of PAP screening. And it focuses, this survey focused on the acceptability of self-collection using a hair swab, and it also focuses on HPV prevalence in Arab and Arab American women in Southeastern Michigan. So finally, a project that focuses on a mental health issue that we also study and teach about in our general epidemiology program. And this project focuses on fatigue and subjective perceptions of sleep in relation to psychotic symptoms. And this was conducted by Tom Coe, an MPH student with advising from Dr. Brianna Mazuk. And the graph on the right there sort of summarizes the findings of this project. And it shows that people who report fatigue tend to have a much higher chance, or greater odds, as we call it in epidemiology, to report auditory and visual hallucinations. On the right side of the graph, you see a very similar pattern, and perhaps even more dramatic, if you will, that people with sleep disturbances also have a higher chance, higher odds, to report these auditory and visual hallucinations. And these findings may further increase our understanding of the role of hallucinations or the role of fatigue and sleep in the occurrence and the experience of hallucinations in the general population. And future studies to follow up on these findings could therefore measure or include more objective measures of sleep and see how they affect certain neurological outcomes, such as psychotic hallucinations. So there are many opportunities for GE students outside of the classroom. So first of all, many of our GE students are involved in hands-on research in collaboration with faculty and staff. And I just showed you three very good examples of that. Secondly, GE students have an opportunity to engage with public health partners here in the area, but also outside of this area in other places around the US. We offer flexibility in internship options from local internship opportunities to international ones. And finally, students in our GE program have every chance, every opportunity to participate in both academic and non-academic activities across the University of Michigan, both here on the campus in Ann Arbor, as well as on the other campuses of the University of Michigan. Thank you very much, and I look forward to your questions. I believe at the end.
All right. Thank you, Carlos. I'll take over now. So hello, everyone. Thank you for joining us today, tonight, wherever you may be. My name is Alexis Handel. I'm associate professor in the department, and I'll be talking about the global health epidemiology track that we have in our department. So the aim of the global health epidemiology concentration is to provide our trainees the technical and the epidemiological skills to work as epidemiologists in any setting, whether it is international or domestic, and under complicated circumstances or complex environments and settings, but with a strong emphasis in working in low and middle income countries. Overall, in the School of Public Health, we have many faculty that work globally in international public health efforts. Specifically in our department, epidemiology faculty work in over 35 countries globally and have research collaborations in a number of countries throughout the world, as highlighted on this slide. And the topics are broad and range from infectious diseases and vaccines, reproductive health, environmental and occupational health, maternal and child health, nutrition, cancer, and social determinants of health, aging, and the life course epidemiology, systems epidemiology, and modeling studies, to name a few. Next slide, please. So on the next few slides, we have organized our global health epidemiology faculty kind of in broad topic areas. And as you'll see, our global health epidemiology faculty focus their efforts in many different research topics across different global regions. So on this slide, I am showing our faculty that focus specifically on global infectious disease epidemiology. And you can see all the different regions and countries where these faculty focus their efforts. Next slide, please. We also have faculty that work on global nutrition, as well as capacity building. Next slide. These faculty are our global cancer epidemiology faculty. And I will note that highlighted in blue, and you'll see myself later, and here, Rafael Meza, we are the current global health epidemiology track leaders. So I just wanted to highlight that. Okay, next slide. That we also have those who focus on social and life course epidemiology, as listed here. And then finally, next slide, we have a number of faculty working in global social and environmental epidemiology, again, in various regions across the globe. Next slide. So as with the other MPH concentrations in epidemiology, the minimum of the credits is 60 credits. It's typically finished after 2 years. So in addition to the coursework that's relevant to the School of Public Health core curriculum and the training that's provided to all of the general epidemiology MPH trainees, which Dr. Mendez de Leon just described to you, students in the global health epidemiology concentration also must complete some specific courses for this concentration. These include those that are listed on the slide here: Introduction to International Health, Field Methods for Epidemiology in Developing Countries, as well as a research seminar on international health. Next slide, please. So students in this concentration are required to complete their summer internship in a low or middle income country, or in a governmental or non-governmental agency that's engaged in international public health work. So students identify their internships with faculty or that are currently working globally, or they might find other agencies or organizations that are doing work that they can work with. So the internship can be research or practice oriented. So, there can be a variety of activities that you're involved in. Then some are listed here on the slide, like developing proposals, helping with data collection, designing surveys and instruments, report writing, communications, as well as some actually do some laboratory science. And some do analysis, but that's not really, that is not the main focus of the internship. The internship is really to take the skills that you're learning and applying them to kind of, real world settings. So the idea is just you get this experience and exposure to public health outside of the United States, and specifically in a lower middle income country. Next slide, please. So I just wanted to kind of finish up this this presentation, just showing you an example of an internship experience. There's a number of different opportunities to get these internships funded, and this is a specific example. We have an Office of Global Health for the whole School of Public Health, and that's listed here on the slide. And there's a specific training grant that actually has paid, structured, and ongoing internships that you can look into. Next slide, please. And as part of this training program, these are just some examples of the ongoing projects and in the countries that these projects are focused in. And you can see, even with the pandemic, where we had quite a few restrictions on travel, there were still projects that happened mainly remotely, but they still happened. And 2020, there were 7 research projects in 5 countries, plus one that's in Dearborn, Michigan. And then last summer, or this past summer, there were 4 sites that were able to provide internships with 5 different students. And I think this year there's a new site in Kenya that was added. So there's a lot of opportunity for some funding, but this is just one example of some of the opportunities that we have. Next slide, please. And this is just to give you an idea of what have been some recent internship sites over the past few years. Again, it's very broad. It can be with nonprofit organizations, it can be governmental agencies, or it can be academic institutions all around the world internationally. And then we also had this past year, there was some work that was done with immigrant populations here in the US, because that is also considered, kind of a global perspective in international public health with, migration trajectories and all that. So this is just an example of some of the past poster projects that students have then reported on once they come back from their internships. And graduates from this program go and work in a real a lot of different areas, whether it's academia or they go and work in nonprofits or government agencies. So and that's it. I think that's all I have to present. So thank you so much, and look forward to your questions.
Okay, thank you, Alexis. Hello, everyone. Good morning, good afternoon, good evening, depending on where you are. So my name is Samgyun Park. I am Associate Professor in Epidemiology as well as Environmental Health Sciences. And I am the track leader of Occupational and Environmental Epidemiology, OEE program. Next slide, please. So OEE track is an interdisciplinary program between epidemiology and environmental health sciences, So we examine, health impact of exposure to environmental and occupational hazards and stressors. So as you can see, the top line, these are our faculty member in epidemiology. And can you hit one more? And then the bottom, you can see, the faculty member in EHS. So, this is an interdepartmental program. So epidemiology and EHS faculty member work very closely and then provide training opportunity for this environmental and occupational epidemiology research and practice. Slide, please. So OEE, so can you hit, yeah. We cover various environmental exposure from air pollution, water pollution, pesticides, heavy metals such as lead and arsenic, and chemicals from the product we use every day, such as bisphenol A, PFAS, and noise, and etc. So we examine various environmental and occupational exposure. And then we link this exposure to various health outcomes, from heart, lung, kidney, brain, reproductive system, etc. And hit one more. And then another important aspect is to evaluate windows of susceptibility. And so we focus on life stage where people become more susceptible to this environmental chemical exposure, especially early life, during pregnancy, and midlife, and later life. Next slide, please. So OE program, basically we, our students take, SPH core curriculum as well as GE, so general epidemiology courses. And on top of that, we teach additional classes, including this exposure science, toxicology, occupational and environmental disease, and seminar in occupational health, and then environmental epidemiology and data analysis for environmental epidemiology. Next slide, please. So we have lots of track activities, including this cross-departmental seminar series and social and network event. And I also want to emphasize that this OE program have funding from the National Institute of Occupational Safety and Health. And so we support tuition and also the research and internship grants. Next slide, please. So I want to highlight, our most recent graduate who did this OEE activity and the research. So the first, Jacqueline Cardosa, who did this community-based participatory research of heat-related illnesses in low-income population. And she's currently work as a disaster epidemiologist at CDC. In the middle, so Juliana Fucinari, who did this ethnic differences in environmentally related cancer in the metropolitan area, Detroit area, who is currently working at Carmonas Cancer Institute. And on the right side, you can see, Josie Gauthier, who is most recent graduate, who did this health impact of urban transportation policy to reduce on-road vehicle emission. And Josie is currently working at Michigan Public Health Institute. Next slide, please. So this is my final slide. So you can see our various activity and social and networking. And so I'm looking forward to your any question, and thank you very much.
Thank you, Sung-kyung. Good evening, everyone. Or good morning, in fact, good afternoon, depending on where you are. My name is, the next slide, please, I think that's it. Thank you. My name is Alex Rickard, and I'm the track leader for the Hostile Molecular and Epidemiology track, referred to as HME. James Angle, if you don't know who he is, he was the University of Michigan's longest serving president, famously said in 1879, "At Michigan, we believe in an uncommon education for the common man." While the language can be updated, the sentiment is much the same. Indeed, HME is an excellent example of this, as students in the track receive interdisciplinary training, so they are qualified to be epidemiologists that interface with hospitals and molecular laboratories. Can you back one slide, please? Sorry. Another one, back. That is me. I'm an associate professor in the department. I also teach the lab class that you will take in the first semester of being in the HME track that will help you prepare for your lab experience in a research laboratory on campus. Next slide, please. Our faculty includes individuals working on bacterial organisms that causes diseases like tuberculosis, diarrheal organisms, and organisms that cause cavities and gum disease. Next slide, please. And also on viruses, such as the work by Emily Martin and Aubrey Gordon and Arnold Monto, focusing on COVID-19 and influenza. Next slide, please. And also on chronic diseases like cancer, heart disease, arthritis, and autism. Next, please. But all HME faculty use genetic sequencing and other omics-like technologies and techniques, like metabolomics, in their research. Next slide, please. At Michigan, the laboratory molecular methods are fully integrated with epidemiologic training. HME students graduate as qualified epidemiologists who are, for a better term, bilingual in laboratory, molecular, and epidemiology vocabulary. We include training and applications in the hospital setting, as that is one place where having HME training is especially useful. There are, of course, other examples. Next slide, please. Okay, the coursework includes classes in epidemiologic methods and statistics held jointly with the other tracks that we've heard from already. Next slide, please. And I should say all HME students must demonstrate competencies in basic laboratory methods like sterile technique and take electives on the principles of microbiology, molecular biology, and genetics, shown here with an asterisk. So whatever your laboratory training you have when you arrive, you'll be able to learn more. Next slide, please. There are also required classes and electives, highlighted here with the electives for the star sign, specific to hospital epidemiology and public health practice. Okay, next slide. And finally, there are two classes whose purpose is to help students integrate the different aspects of training. The first is EPID 565. This is research in hospital molecular epidemiology, and the second is in EPID 582, molecular epidemiology. And I want to take a second and just tell you about 565, and that is that it's a very crucial class meeting for students to actually develop their research interests, to network, and to find placements in labs across campus. Next slide, please. And a special feature of HME is that the students through 565 have mentored research experience that begins shortly after enrollment. This might be working in a laboratory to develop or interrogate a biofilm model, much like my interests are in, or to use single-cell sequencing or microarrays to address specific research questions. Students might use qPCR to screen for the frequency of a disease or exposure of interest, or analyze genetic sequences for virulence genes or antibiotic resistance, or to trace outbreaks. These experiences might be with HME faculty or faculty anywhere on the UM campus, including the medical school, dental school, College of Engineering, and the biology departments in the College of Literature, Science, and the Arts. In addition, HME students might spend a summer working in infection control in a hospital or at a public health laboratory in the US or internationally. Next slide, please. HME training and experiences prepare HME students for jobs in many settings, or to continue their education in epidemiology, microbiology, or at professional schools. HME students are very competitive for fellowships, like those from the Council of State and Territorial Epidemiologists, and also NIH and even industry. There are many opportunities. Okay, with that, I thank you for your time, and I will pass the stage to Professor Rafael Meza, who will describe the computational epidemiology and systems modeling track. Thank you for your time. I look forward to your questions.
Thank you. Good afternoon, good evening, good morning, everybody. It's my pleasure to tell you about our newest program in the Department of Computation, Masters of Science in Computational Epidemiology and Systems Modeling. Next slide. So this is our newest program, but I think it's pretty unique, and it's creates a great new opportunity for students who have an interest in quantitative sciences, either social or life or, or hard sciences, and to apply those techniques, tools, knowledge in solving public health problems. And in particular, for a program of this kind, we're pretty unique because we have a quite considerable number of faculty that are working in this space of what we normally call modeling, systems modeling, computational modeling, epidemiology modeling. And so we're very excited to launch this program. This will be our second year. We're currently with our first class, and we're looking forward to having more students. So next slide. This is a 48 credits. It's a Master's in Science program. So as opposed to the previous tracks that are MPH, this is a Master's in Science, whose goal is to train a highly skilled epidemiologist who can also understand and analyze public health problems and tackle those problems with mathematical, statistical, and computational models. So while there is a lot of focus in this degree on the tools and techniques, computational, mathematical, statistical, in the end, this is a degree that is supposed to prepare you to be epidemiologists who have those skills. Next slide. So this new program has, as I mentioned, 4 core areas: epidemiology, mathematical modeling, and we'll talk a little bit about what that means in a minute, statistics, and computing programming. And there are 3 components or 3 elements of this master's, which range from core courses within our department that introduce and further explain concepts in epidemiology, math modeling, and stats and computing. Electives within our department and other public health or School of Public Health, as well as other departments across campus that you can select to further your training and skills in modeling. And also it will require a capstone project to be completed under the supervision of an advisor in the last 2 semesters of the program. Next slide. So when I talk about models and modeling, what I'm talking about in this specific case are these type of models where, for instance, you track how individuals might move across compartments with regards to an infectious disease. Here is one example where we're, of a model that was developed by professors Eisenberg, and Brouwer to characterize dynamics of polio transmission. And this was actually used in Israel to try to differentiate environmental versus direct transmission. And it was developed in response to an outbreak of polio that happened in Israel. And so these type of models really end up not just looking like this as a diagram that captures the transition from being susceptible to getting infected from the disease to finally recover, but of course will also come with equations that can be either solved analytically or implemented in a computer so you can run simulations. Many of you probably have seen this type of work in modeling in action, of course, with the COVID pandemic, and where every country, every state, every even news organizations have put out their models and their projections. So next slide. So this is a new program, so I cannot tell you much about the successes of our students, but I can tell you about where we want to go by showing examples of what we're doing. So next, for instance, and I just mentioned it, but our faculty has been actively working on COVID response. And for instance, this shows works by Professor Marisa Eisenberg and colleagues, where they've been doing projections for the state of Michigan of where the pandemic might go. Not just as a projection, but also trying to get a sense of what if the state would do different interventions, and then what would be the impact of those. Next slide. We also have a very active group that's working on tobacco and smoking. And for instance, there was recent work that estimated what would be the impact if we ban menthol from cigarettes in the US. And as you can see, projections of how many lives would be saved or premature deaths would be prevented. And again, that work having impact of what happens with regulation of tobacco products here in the US. Next. We've also, some of our faculty have done work projecting the impact of a new type of cancer screening, lung cancer screening with low dose CT, and what would be the effect of different recommendations, and again, influencing what the guidelines are here in the US. Next. And for instance, some of other types of models that have been used were Andrew Brower and colleagues, they've done analysis of state data on hepatitis A, and have made projections and estimates of what is the transmission in the state. Next. We're really fortunate here in Michigan because it's a great place, not only within the School of Public Health, but there are many centers across campus that have expertise and where there is faculty working in these areas. So you would be able to not only benefit from all the great people that we have here, but also connect with many of these other centers and institutes within the university. Next slide. So while we don't have students yet that have graduated, we hope we'll have some soon. And we expect them to be able to work in multiple places. As you know from the pandemic, CDC, NIH, FDA, WHO, the Institute of Health Metrics and Evaluation, they're all doing modeling and recruiting modelers who can help them with their projections and analysis. Health departments certainly are now recruiting more and more modelers to help them with multiple variety of issues. It's lighted there. Of course, in academia, you can certainly think about using this as a step towards doing PhD research. And then finally, yeah, industry also requires modelers to help them with their planning and also with their decision making. So with that, I'll end and pass the microphone. Thank you.
Thanks, Rafael. Hi, everyone. I'm Jennifer Smith. I am chair of the Admissions and Recruitment Committee in Epidemiology, and we're accepting applications now. So you can get to the MPH applications by going to the website listed here and clicking Start Your Application. This will take you to the SOFA system where you'll create a login and get started. Next slide, please. If you're applying to our MS program, you can get to that application by going to the Rackham website listed here and clicking Apply. And this will take you into our Rackham Graduate School system where you can create a login and get started there. Next slide. The applications for our admissions include an application form, a statement of purpose and objectives, a reflective essay, your official transcripts, 3 letters of recommendation, and then for the MPH program in SOFIS, you can select more than one designation. So we have, obviously you've heard about the different tracks in EPIDs. You can select more than one track in EPID. You can actually also select 2 different departments within the School of Public Health. So make sure that you list your first choice as the first option and kind of go from there if you're interested in more than one program. We do have rolling admissions. We have a priority application deadline, which is December 1st. And if you apply by that priority deadline, you're guaranteed to be considered for the first round of funding that we allocate. And if you aren't able to make the priority deadline, we'll have another round of funding a few months later, and you'll be considered then until we run out of funds to distribute. The final deadline for international students is January 15th. And the final deadline for domestic students is May 15th. So please start early, and that'll give your recommenders time to submit their letters and for your transcripts to get here. So thank you. So what makes a strong applicant? Well, epidemiology is really a discipline that's rooted in the life sciences, in study design and methods, and in quantitative analysis. And so in thinking about that, we're sort of looking for evidence of both academic and potentially practical or work experience, doesn't have to be, that'll prepare you for a rigorous graduate school curriculum here. And so we take a very holistic approach to reviewing applications. We look at, of course, grades, we look at key coursework. We don't have any required courses, but we do recommend that applicants take courses in the life sciences like biology and chemistry. We also would like to see some college level math or statistics classes like algebra, calculus, or sort of intro statistics. For the statement of purpose, we're looking to make sure that you have a clear understanding of epidemiology. And if you have a particular area of interest for research or study, you can also put that in if you'd like to. For the reflective essay, we're kind of looking if there's anything on the application that you want to explain, like if you had a bad semester, or if you have socioeconomic or other hardships that influenced your educational trajectory or your goals, you can put that in the reflective essay. We're interested in knowing about your work and your practical experiences as well. That includes things like research, volunteering, and professional work. So you can tell us about all of that and highlight the experiences that are related to epidemiology, to public health, to medicine, health disparities, and any quantitative skills that you've sort of picked up along the way. For the letters of recommendation, I encourage you to think about your recommenders. So we really like to see at least one academic recommender if possible. So that would be probably a professor. Somebody who supervised you in your research would also be good. If you have supervisors at other work experiences, that would be great. We also have a quantitative experiences statement. And so we're asking you there to summarize your quantitative and analytical skills by discussing examples of relevant research, work, volunteer, and professional experiences. And just tell us about how you've used data, if you have used it, how you've analyzed it, and how you communicate the results. And then we also ask in a separate section now for you to list out each of the college level quantitative and analytical courses that you've taken, and that will help us evaluate that quantitative piece. We no longer need or want your GRE scores, so we don't ask for those. We don't use that in our review. Thank you, next slide. Students are always interested in financial support, and so we do have some departmental scholarships, or what we call Dean's Awards, that are available to help fund tuition. About 40% of our master's students receive some kind of tuition assistance through departmental scholarships. We do our funding allocation at the time of admission, and that's why you want to get your application in by that priority deadline if possible. The funding awards are made actually for both MPH or master's MS years at that time. So at the time of application, we'll review you, we'll give you an offer, and it'll be through both years that you're here with us. We also have a couple of other pots of money. So for example, from the occupational and the occupational epidemiology, we also have some training grants and things like that. So we'll start looking at you for those kinds of opportunities as well. We do have work study for domestic students who qualify. We also have, we also have a limited number of students that have attained graduate student instructor or research assistant positions within the EPID department and externally to our EPID department, but this is only about 5% of our students. And then of course you can always take out loans. Okay, next slide. I think I'll turn it over then to our student services team.
Thanks, Jen, for covering the admissions. I'm Nancy Francis, and I'm the admissions coordinator here at the epidemiology department. We have a really strong student services team here in epidemiology. And so for all of your admissions questions, you can email me. I am the contact person for the admissions questions. And we also have a really great website that you can reference to answer a lot of your admissions questions. We also have webinars that are posted on the website that specifically talks about the epidemiology tracks as well. And if you have any questions, please feel free to reach out to me. And now here's Dominique, another one of our wonderful student services representatives.
Hi, everybody. My name is Dominique. I work in the Student Services Department. I work with students, helping them find internships and applied practice experiences. Once you choose U of M and you are admitted and matriculated, you'll work with Elvira and myself to finish those graduation requirements. So hope to meet you all soon.
Hello, everybody. Good afternoon, good morning, good evening, whatever time zone you are in. My name is Elvira Rivera, and I'm the Student Services Coordinator for the Epidemiology Department. I am part of the amazing Student Services team here in the Epid Department. And right now you're thinking about the Epid program, if it's for you, and Nancy will take care of you all throughout the admission process. And then once you are admitted and you've decided to come to Michigan and matriculate, then Nancy passes them on to myself and Dominique, and we take care of you during your entire time in the program, making sure that you've met all the degree requirements, making sure that you're progressing nicely, making sure that you have all the resources you need to be successful in this program. With that, we work collaboratively with the school and other resources that help you succeed in our program, such as, for example, listed below, the Office of Student Engagement and Practice, our career services. We focus on your health and well-being. We have our Office of Global Public Health. We have our public health action support team. And then we also offer tutoring services for those students who just need a little extra help in the EPID classes. We also work very closely with our careers office in terms of job and internship fellowship postings, workshops, employment recruitments, resume assistance, and interview prep. So there is so much that is here to help you succeed. And if you have any questions in terms of curriculum, just logistics, planning, please feel free to reach out to me and email me. If you do have any admissions related questions, you want to reach out to Nancy. And on that, I'd like to introduce Andrea Hill.
Hi, everybody. My name is Andrea Hill. I'm the Student Wellness and Inclusion Advocate. I'm a social worker with a background in mental health, and that's how I got into this position, because I'm here to support the wellness and inclusion of the students. So I do that in private support meetings, as well as event planning for community building and working with the diversity, equity, and inclusion efforts. And just to kind of look at the different communities that do come together at U of M, we have groups of students with children and students with disabilities and students in military service members and veterans, LGBTQ students, students of color, international students, first generation students. There's over 40 SPH student organizations, and these groups can be university-wide, at the school level, or at the department level. And one of the fun things that I get to do is when a student wants to start a new group, I can support that as well. And just to mention one important resource, and there are many, many others, but the university offers the counseling and psychology services, psychological services. We say CAPS for short. And that is mental health support that is included with your tuition. So if you find yourself needing to talk to someone about family or emotional things that come up while you're here, that's always available. And Megan Narula is our embedded CAPS counselor. She's at the school in the building. But there's a larger office that's available as well. They have urgent hours, and they have groups and classes and online resources. So just to mention that, there's many other well-being resources as well, but that's an important one. So I think we're going next to Sarah, is that right?
Yes.
Change the slide.
I'll wait
Next
for
slide. There we
Okay,
go.
cool.
All right.
Um,
Bye.
Hi, everyone. My name is Sarah Gao. I am a second-year MPH student in the general epid track. I'm also pursuing a certificate in social epid. I use she, her pronouns, and I am the president of the Epidemiology Student Organization, which goes by ESO for short. And so basically we serve as kind of like the liaison between the students and like the faculty and administration. And so we do that in a lot of different ways, like through providing feedback on classes, as well as professional development, events and resources. And then we also hold like social events, and we do, yeah, like we just went to like a apple cider mill recently. And we're just sort of here to provide all sorts of support for the students. All right, so I guess I can go first in terms of why I like it here at Michigan. And that's, I really like how collaborative everything is here, like not only with the faculty doing a lot of interdisciplinary work, but also the students themselves. I feel like everybody here has been very friendly and helpful with all sorts of like homework, and I've never felt like it's a competitive atmosphere. Everybody is really working together to succeed in classes.
Okay, I wasn't sure if I was going. So in terms of why I chose Michigan, initially what drew me to the school was really the research. I was looking into Dr. Viamore's work and I was like, wow, this is so impressive. And that's where I want to be. So I went ahead and applied. And once I got here, what really made me love my experience was really the staff and the faculty. I haven't felt more supported. And if I have a question or anything, just like Elvira, Dominique, all of them, like they've been such a great source of support. So that's why I enjoy this experience so much.
Hi, everyone. My name is Antonio. I'm a second-year global health epidemiology student, and there were two primary reasons that I decided to come to U of M, and those were the flexibility of the degree paths with the options to pursue certificates, and the connections that the University of Michigan has all around the world, as well as within the United States. Those two things put together give you so much flexibility to pursue whatever you want. And if you have a specific interest that is within the realm of public health, or even in the medical field or in research in general, there's almost guaranteed to be someone that can point you in the right direction to get to that.
Hi, everyone. I'm Madison. I am a second-year hospital and molecular epidemiology student. Like Antonio was saying, a large part of the reason I came to Michigan was because if I wanted to do something, I could do it at Michigan. So if I wanted to do research in the medical school, I was able to collaborate and do work through the medical school. If I wanted to teach in the undergraduate biology department, I was able to teach. So there's so many different things you can do in addition to just being a student in the School of Public Health throughout the entire university. Additionally, in a, not just being a top ranked program, you also had that concentration, right? So I love that I could be in a specific concentration where I was getting laboratory research in addition to epidemiology and building upon my undergraduate experience as a molecular biology major.
Hi, everyone. My name is Chetan, and I am a first-year student in the new Masters in Science of Computational Epidemiology and Systems Modeling. And I also am an international student here. I chose Michigan because they were on the cutting edge of a lot of the research going on, and that really interested me. I come from a background in medicine, and I wanted to take my career in the direction of medical research. So this is my second master's program here. I initially did a master's in hospital and molecular epidemiology, and I took up modeling as an elective, and that got me super interested in it. And now I'm doing a master's of science in it. So that should really tell you the kind of breadth of experience you can have at Michigan, wherein even if you choose a specific track, you can gain a lot of exposure to a lot of different things and explore your interests.
Hi, everyone. My name is Hannah. I'm a second-year occupational and environmental epidemiology student. And just echoing what other people have said, I think a huge thing for me was I wanted to attend a larger university because I feel like there's so many resources. Like, for example, I was like working on this project that had some like statistics that was like really far over my head, and I was able to go to, there's like a resource center for like statistics help that might not have been available at a smaller school. But then again, it's like also not like what Sarah was saying, it's not like super competitive, it's a lot more collaborative, and that's been sort of a weight off after undergrad, which can be a little bit more competitive. And then in addition, I thought that the program had like a really strong quantitative focus. There's a lot of professors who have a strong background in math and statistics, and that's like something that's really important in epidemiology. And that is definitely like, I was attracted to the program because of that, and that's like definitely rang true throughout my time here. So yeah, I think that was a huge factor for me.
All right, so that's the end of our presentations, and now I think we're going to transition into the Q&A period. And so I know a lot of you have sent in some questions over the chat, and we've been trying to answer questions as we go. I also noticed that a lot of people are asking questions in the Zoom Q&A function. So if you haven't seen those, there are also quite a few answered questions in that function. So at this point, I think there are answers to all the questions so far, except for one. And so I think this is about qualifications for in-state versus out-of-state tuition. Nancy, can you clarify where people would try to figure out whether they qualify for in-state versus out-of-state? Nancy, you need to unmute yourself.
Sorry. So is the question where on the application, or?
So I think for students who don't know for sure whether they would qualify for in-state or out-of-state, is there a specific office that they would use?
The residency office here at the University of Michigan is the first place to start. So when you apply, you can contact the residency office, and they will definitely be able to tell you if you're in-state or out-of-state.
Thanks, Nancy. We have another question for the student speakers. So this person is interested in knowing, what are your backgrounds in school and work experience prior to enrolling at U of M? So maybe a couple of people, couple of students could answer that.
I can go first. So I actually did my undergraduate at Michigan. So I actually had no work experience when applying. The most experience I had was in athletics and working in a lab in my undergraduate. So I just came right in from undergrad. Oh, I was also a molecular biology major. Yeah.
Yeah, my background. Oh, sorry, go ahead.
Yeah, I can go real quick. So I also went straight from undergrad. I went to Rice University, and I actually double majored in history and women's studies. So like, don't feel discouraged to apply if like you didn't major in STEM, because I definitely did not major in STEM, and I didn't take like the most math or science courses in college, but I am doing just fine and I'm really enjoying it. So.
Yeah, my background was I had a dual degree in Spanish and math, and I took a year off and I did research in like computer science and informatics, so not super related. And then yeah, came here after that.
maybe one more student?
Sure. I did my undergraduate degree in public health. So I had a bachelor's of science in public health, and then I joined the Peace Corps. So I was using my public health degree in Mongolia for 2.5 years before coming to the university. So I had some prior work experience with working with public health in a low and middle income country, which is what drew me to the GHE program at U of M.
I think one thing that the students will probably agree on is that people come here from a big, diverse set of backgrounds. And we have, people everywhere from, sociology to math to, different science fields, all kinds of places, engineering. So we're really happy to have that kind of diversity here. Another question that's come in is, how feasible is it to complete a certificate? So we have a couple of different certificate programs at the School of Public Health and actually at the broader university level. And Elvira might be a good person to answer this question.
Thanks, Jen. Yes, it is definitely feasible to pursue a certificate with your MPH or MS program. All it takes is a little planning with me, and every certificate tends to have like a certificate or track certificate lead, faculty lead, or there's a staff member who is associated with that to make sure that you're just on track. So as long as you check in with me, for them, like, you definitely have to check with me so that we're not missing a step. Your degree audit is going fine. You're graduating, no problems. And then I would point you to another person who's organizing all the certificates, because there's another person that the school has for that purpose, and you'll be fine. It's probably an additional 4 or 5 classes, and it can be easily tied in with your degree program here with us.
Thank you. Another question that I see is just clarification that the MPH programs are 2 years, and that is correct. And that the tuition is based on whether you're in-state or considered out of state. The tuition, I believe, is fixed based on whether you're in-state or out of state. But we do give partial scholarships for tuition that I talked about, those Dean's Awards. And those scholarships are usually given, we give a couple of full awards, so we cover your whole tuition. We give a fair number of half awards, and then occasionally we'll give another, sort of part, like a quarter of your tuition. And again, if you receive one of those awards, it does cover both years. I don't know if anyone else has anything to add to that question. You see it in the chat, Elvira or Nancy. Okay.
I'm good.
Okay. A further question was regarding the global health internship. Are there opportunities to do the internship in countries that aren't listed or shown on the slide where the faculty have existing experience? And so
I can.
Thank you.
Yeah, I was typing quickly, but yes, I think like it was said before, a place like Michigan has really hundreds of opportunities across the university, of course, within the School of Public Health, within the Department of Epidemiology, but also at the medical school and other places. We have a new global center for health equity, and there is the International Institute, and really the opportunities are plenty. So you're able to explore those within the university, but also there are cases where students have found their own internships, and then they've been able to work with the global health faculty, so we can like review what are the plans and make sure that it will be appropriate to satisfy their degree requirements, and also a good experience for them. So absolutely, it's I think one of the nice aspects of the global health program is that students get to really think about and explore opportunities for their internships and research experiences. And yeah, at times maybe when you're here, it's challenging at the beginning having to find one, but by the time they're done, it's there. I think they all agree that it was all worth it.
Great, thank you. Another question that came in was, how do you apply for the funding options that we discussed? Does this happen after admission to the school or with the SOFIS app? So we receive in the admissions committee, we'll get your application and we'll review it for funding. And then after the priority deadline, we will look at all the applications that have come in and we will make decisions about funding. At that time, it's not a separate application. We consider everyone for funding. And then again, a few months later, sort of around, February or March, we'll look at people who have applied and been admitted by that point, and we'll try to make another round of funding allocations. And so you don't need to do a special application. You'll automatically be considered for that. Then the graduate student research assistants and graduate student instructors are positions that are posted either within the epidemiology department or external to our department. And you would apply for that separately at the time that it was posted. With the graduate student research positions and work study opportunities, you would be specifically applying with a faculty who is doing research that you might be interested in. So you would need to reach out to them specifically to ask if they have any positions available if you're interested in something like a work study or an hourly graduate assistant position.
So can I add one?
Yes.
Okay, so hello everyone again. So I am a OEE track leader, and so only for OEE, sorry for other tracks, but we have additional funding for the U.S. citizen and permanent resident who get admission in this OEE program. And so this funding is coming from NIOSH, so National Institute of Occupational Safety and Health. And so for those who have funding from the department, so then this could be additional funding. So for those who receive, let's say, half tuition, and then we can add more. But for those who don't have any departmental funding, but still we cover some portion of the your tuition. And so this could be a kind of your funding package. And I know that there are multiple institutions, offer various this financial support. So we try to give you competitive this funding package to you.
Thank you, Sung-Kyun. Another question that just came in, how do we decide if we're thinking about choosing between a general epidemiology and global health epid? They have some similarities. Can you transfer to different tracks later after you matriculate? So when you apply in the SOFIS application, you can choose multiple tracks that you want to apply to or just one. If multiple tracks are interesting to you, then you should definitely try to rank them. The big difference, well, once you are matriculated, yes, you can move from track to track. The global health epidemiology is a little bit different in that it is harder and definitely not recommended to transfer into that track once you get here, because with global health, we have to be thinking a lot more about placing people in internships. And so there are a more limited number of spots in that program. And so if you're definitely interested in global health, I would apply to that program and put general epid second. People who are in general epidemiology can still study global health, but we don't guarantee that we'll be able to find them an internship globally. The global health track really is for people who have a primary interest in working outside of the United States, I would say. Raphael, do you have anything to add to that?
No, just that, yes, I think certainly within general epidemiology, there are opportunities to do global health, and I think within any of our programs. So I think you should see this as more opportunities rather than competing. I think the global health EPI program is specifically designed, and you're basically committed to doing that. Whereas general EPI will provide a little more flexibility, for instance, for you to explore and then decide if you want to do it or not. Some students here end up, maybe we have both transfers from GHE to GE and from GE to GHE based on preference of how much flexibility they want and I guess the ability to explore different types of opportunities.
Thank you. Two more questions I see coming in. The first one I'll take is someone who had asked about workload. So for people who are working full-time, they're kind of asking about, do we recommend working full-time or working part-time if we're pursuing, for example, the master's in epidemiology due to the course load? And I will give my answer, which is I haven't really seen very many students who work full-time and who can complete the MPH program, or as I'm assuming that our new MS in epidemiology program, they're very time intensive and work intensive. So I think about 20 hours a week is probably all I would recommend. I don't know, Raphael, if you want to say anything else, as they were referring specifically to a master's in epid.
Yeah, no, I think that's I think I agree with your comments. I think even as a student, you're required to be enrolled a certain percentage of credits, and that also limits the time that you have for other things. Certainly, it's not that common but some of our master students end up taking GSRI positions, and those are 20-hour positions, and I think those who are doing it they are pretty busy, and it does require a lot of effort and commitment.
Thank you. So this next question is for current students. Maybe we'll have 3 current students answer briefly. Did you have an exact career in mind? The question disappeared. I think it was, did you have an exact career in mind when you applied, or was it something that evolved? Maybe one of the current students who didn't answer the last question could answer that one.
Yes, I had typed in an answer, so it disappeared. Sorry about that.
It's okay.
So yes, my career trajectory definitely has changed since coming to Michigan, in a positive sense. So when I applied, I was just, my idea was to get into clinical research, and I found myself lacking in knowledge about epidemiology, and that's why I wanted to pursue a master's in epidemiology. So as I mentioned before, I did a master's in hospital and molecular epi before getting into the current MS program I'm in. And during that process, my interest certainly shifted more towards modeling after attending a couple of classes as electives in disease modeling. So now I'm looking more towards disease modeling as a career as opposed to clinical research. And I would certainly recommend having an open mind about where you want to take your career while going through your master's program.
Great. Another student?
Yeah, I can go ahead and share.
Thank you.
So when I first applied, I was thinking, okay, I'm interested in epi, but I didn't necessarily know where my research interests were. So like now in terms of working with the ILE, I know I have an interest in epigenetics, for instance. And in terms of career, I was also thinking of an MHSA and like administrative. So I think once I got into the program, I've noticed how my interests have expanded. So it's not just the slight interest in epi, but now I know what I want to research and what I want to look into, and potentially a PhD, but I haven't committed just yet. So we'll see.
Okay, great. Another question that came up is the priority deadline. So Nancy, will you answer that question about the deadline? Being December 1st?
Yep. So the deadline of December 1st is when you should submit the application. It does take a while for letters of recommendation and transcripts to get to us. So those things you should start on early, but the December 1st deadline is a submit date.
Thank you. One other question that has come up is about the internship. So we mentioned about the internship for global health. Is the internship also required for students in general epid or just students in specific tracks? So maybe I'll let Elvira or Dominique answer that one.
I can take that question. There is an internship requirement for all tracks with the exception of our HME track. So our global health epidemiology, our general health epidemiology, and our occupational and environmental epidemiology tracks all require an internship. For our hospital molecular epidemiology track, it's not required, but if you want to do one, we would never tell you no. We would never take away an experience from you. And you can work with your track leader to discuss options and just ideas and whatnot for an internship.
Great, thank you. Another question I've seen come up a few times now is about the PhD, and can the MPH sort of serve as a stepping stone? Are there opportunities, sort of for a combined MS or PhD program? So maybe I'll just say for people who are interested in that, we do take students from our MPH program into our doctoral program fairly often. We also take doctoral students from outside of U of M. We do feel like the master's program, that the MS or the MPH program are both great for preparing you for a possible PhD. One other question that came up was sort of around GPAs. And so one thing that I'll just say again is we really do look, sort of holistically. So if you have, strengths and weaknesses on your transcript, just go ahead and explain those. And we'll definitely try to look at that as a whole. I don't think that we draw hard lines onto, this GPA, you're automatically disqualified or something like that. I'm not seeing any other questions. Nancy or Elvira, or does anyone else see anything that we haven't answered yet? No.
I've been looking at it. I think we've got them all.
Okay, great. Well, I really appreciate everyone taking the time to come and spend time with us today. And we're available via email, if you want to reach out, and we'll be looking forward to seeing your applications.
Someone has their hand
Yeah.
raised.
Yeah. Thank you. Oh, sorry. You said someone has their hand raised?
Yes.
Okay.
I guess they decided to.
Sorry.
Yes, Nancy has her hand.
Okay. Okay. Well, thanks again. We will be available via email. So send us your questions, and we'll look forward to seeing you here on campus next year. All right. Bye-bye.
Thank you.